equation is for the right colic flexure, and right renal equation is for the right kidney. Now about the right lateral surface. See, the right lateral surface is related to 7th, 8th, 9th, 10th, and 11th ribs on the right side. So diaphragm separates. This is the diaphragm which separates the postodiaphragmatic recess right side and right lung, and also this lower one third of the costal arch. This surface lies opposite to the 7th to 11th ribs. Now the peritoneal ligaments. Liver is covered by the different peritoneal ligaments. The first ligament, that is the falciform ligament. There are the two layers of the falciform ligament. This is the entire falciform ligament which separates the right lobe from the left lobe. And also it is attached to the undersurface of the diaphragm. This is the undersurface of the diaphragm, and posterior border of this ligament is free, which contains the ligamentum teres. This is ligamentum teres. And second is the coronary ligament, which is also have the two layers, superior layer and inferior layer. This is superior layer, and this is the inferior layer of coronary ligament. And this coronary ligament is contains the superior and inferior layers, and together it forms the right triangle ligament on the right side, and the left triangle ligaments on the left side. And the large area between superior and inferior coronary ligament, that is called the bare area, which is bare area means non-peritoneal area, and it is bounded by right triangular ligament boundary and the left triangular ligament boundary. So this is the superior layer and this is the inferior layer of the coronary ligament, right triangular area, and this is the left triangular area. Now this bare area is a non-peritoneal area, I further repeat, and this contains the groove for the inferior vena cava and the right suprarenal gland. Now the right triangular ligament, this is the superior layer and this is the inferior layer of the coronary ligament, which forms the right triangular ligament. And on the left side or on the left lobe, this is also the two layers of the coronary ligament, which gives the left triangular area. Now the lesser omentum. As you know that there are two omentum, greater and lesser omentum. The lesser omentum which connects the stomach with the liver, that is called the hepatogastric ligament. This hepatogastric ligament, this is the lesser curvature of the stomach, and this is the porta hepatis, lips of the porta hepatis. So porta hepatis, lips, and the lesser curvature of the stomach, which are attached with each other by the lesser omentum, that is called hepatogastric ligament. Another ligament that is hepatogastric means the stomach with the duodenum, which also extends from the porta hepatis to the first part of the duodenum, this first part, and which contain common bile duct, hepatic artery, and portal vein. This is the content of the porta hepatis. Now, the two ligaments which are rudimentary, that is the ligamentum teres, it is also named as round ligament, and the ligamentum venosus. These two ligaments are rudimentary because after the birth, these ligaments are converted into non converted into fissure. That is called, it is called rudimentary ligament. So first about the ligamentum teres. It is a rudimentary fissure in front fetal life, the umbilical vein joined with the left branch of the portal vein during fetal life, not after birth. So this is ligamentum teres. This is ligamentum teres, which also responsible for separation of the left lobe from the right lobe. See, this is left lobe, this is right lobe, this is anterior lobe, this is posterior lobe. Another ligament, that is ligamentum venosum. It is also rudimentary ligament. And in fetal life, the ductus venosus, which is the large vein which carries the blood from the left branch of the portal vein to intervenator. After birth, it is converted into fissure. So this also separates the right lobe from the left lobe. This is the anterior view and this is the posterior view. Now about the development of the liver. The origin of the liver in both the ventral portion of the foregut and the endoderm. This is the histological view. This is the central vein. This is portal triad, means portal vein, hepatic artery, and bile duct. These are the hepatocytes, and these are the sinusoids. So numerous hepatocytes with prominent central nuclei. This is the hepatocyte with the central nucleus, black colored indicates the nucleus. Portal triad contains the branches of hepatic artery, portal vein, and the bile duct tube. This is called the portal triad. And liver sinusoid lined by the Kupler cell. So if we see the slide of the liver, we found this structure, that is portal triad, hepatocytes, and the sinusoids. Now the functions of the liver, which is very important. Why this gland is very important for the digestive system. So first function of the liver is the secretion of the bile and formation of the bile. This is a fat emulsification which breaks down large fats into smaller droplets to easier digestion and neutralizing the stomach acid to create an alkaline environment in the small intestine necessary for the digestive enzyme. These digestive enzymes are secreted by the pancreas. So root of the bile from the liver. Liver forms the biles and via right and left hepatic duct, it forms a common hepatic duct, and this hepatic duct drain the bile into gallbladder where it is concentrated, and the common cystic duct and common hepatic duct, which is from the common hepatic duct, common bile duct, which ultimately drain into the second part of the duodenum. So formation of the bile for the fat emulsification break down the large fat into smaller droplets and available for easy digestion. Second most important function is detoxification. So blood coming from the digestive organs flow through the portal vein to the liver. Now the portal vein, which is formed by the union of splenic vein and the superior mesenteric vein. And the superior mesenteric vein drain the blood from the entire small intestine to the upper part. It combines with the splenic vein and which forms the portal vein behind the neck of the pancreas. So portal vein carrying nutrients, not only the deoxygenated blood, but it carries the nutrients, medication, and also toxic substance which are which are taken or drained with the help of the superior mesenteric vein. Now, once they reach the liver, these substances are processed, they are stored, they are altered, they are detoxified, and passed back into the blood to release in bowel to be eliminated. The third and most important function is metabolic. Three important metabolism which is performed by liver: carbohydrate, lipid, and protein. Now, carbohydrate metabolism, how it performs? It converts the excess glucose into glycogen for storage and synthesizing glucose during fasting. So excess glucose is converted into glycogen and it is stored. Second, lipid metabolism. The liver produces and break down the fats, synthesize the cholesterol, and convert excess fat into triglyceride for storage or transport. So we know that the triglyceride is the first stage before the cholesterol. So excess fat is converted into triglyceride, which is performed by the liver by the lipid metabolism. Now the third important or essential constituent for our body, that is the protein. Protein metabolism, it synthesizes the essential proteins like albumin and clotting factors and processes amino acid and converting toxic ammonia into urea and excrete it. And it also metabolizes and detoxify the harmful substances such as drugs and pollutants and converting them into harmless substances. So this is the third important function, that is the metabolic function of the liver. Now fourth, synthesis, producing nearly all plasma protein like albumin and clotting factor, as well as essential non-protein substances such as urea, bile, acids, cholesterol, lipoprotein, and glucose from other nutrients. So synthesis, the fourth important function. It also stores, liver also stores the glycogen for the energy, and different vitamins like A, D, E, K, and B12, and the minerals like iron and the copper. The blood supply of the liver, the main arterial blood supply, that is the hepatic artery, which is a branch of the celiac trunk. This artery provides the liver with oxygenated blood from the general circulation, which is vital for the metabolic activity of the liver cells. The veins, that is the important hepatic portal vein, these vessels carry blood that is rich in the nucleus, nutrients absorbed from the digestive tract, such as carbohydrate, fat, and protein, as well as hormones like insulin and glucagon. It accounts for the majority of the blood flow to the liver. So, portal vein carries the important constituents from the digestive tract and metabolize it, and also the hepatic vein, which drain the deoxygenated blood. The lymphatics of the liver is rich in the protein and mostly product of the hepatic sinusoids, which is seen in the histological slide. It passes via deep and superficial pathway to nodes above and below the diaphragm. The nerve supply, the sympathetic nerve supply by the celiac plexus of the nerve, and parasympathetic by the vagus nerve. These fibers enter the liver at the porta hepatis and follow the course of branches of the hepatic artery and the portal vein. Now, the most important part, that is the applied anatomy. Whether liver is palpated or not. Palpation of the liver. Palpation is the key feature of the examination. As you know that the inspection, palpation, percussion, and auscultation. So, palpation of the liver, the entire surface of the liver comes in contact with the intraabdominal wall and the epigastrium. However, in normal condition, liver cannot be palpated because it is covered by the rectus abdominis muscle. But dullness in the area can be elicited on the percussion by knocking the liver. Now, palpation when occur. The lower border of an enlarged liver extends beyond the right costal margin and can be palpated easily after a deep breath. Deep breathing, then and then we can palpate the liver. Here is the three features: mild enlargement, this is moderate enlargement, and this is severe enlargement. In the different pathological condition of the liver is palpated because of the different category of the enlargement, that is mild, moderate, and severe. Now, the intersegmental plan and segmental dissection. The hepatic veins are intersegmental position. As we learned before that, there are different segments are present in the liver, and each segment have their own blood supply. So, intersegmental plan and the segmental dissection. The hepatic veins are intersegmental in position. See, this is the hepatic vein. And during segmental resection of liver, intraoperative ultrasound is used to detect the intersegmental plan. So, in which plan where the resection is required? The segmental resection of liver is undertaken to remove only the disease segment of the liver. So, out of eight, if suppose in this segment only the pathological changes are developed, and if we have to remove this, then we can do it because a large volume of liver parenchyma can be removed as healthy hepatocyte have a great capacity to regenerate. So out of any lobe, any segment of the liver, not lobe, if we resect any one, then it can be regenerated with the healthy hepatocyte. So the intersegmental plan is very important to know in which area or in which segment the pathological changes are developed. Also, we come to know about the pathological changes with the help of the biopsy. A liver biopsy is a bit of liver tissue is drawn out for the purpose of histopathological study. And usually the location is very important. Right ninth intercostal space in the mid axillary line, mid axilla, and the ninth intercostal space chosen to insert the biopsy needle. This is the specific location through which we can insert the biopsy needle. Then after the skin and fascia, the needle passes through the external oblique muscle and the intercostal muscles, and then right costodiaphragmatic recess, the diaphragm, and the right anterior subphrenic space. Then we can collect the material and send for the biopsy. And through the biopsy, by the histopathological study, we come to know about the disease. Then the liver trauma. Liver is a very soft and pliable structure enclosed in the fibrous capsule, and its close relationship to the lower ribs must be emphasized. Now, where the liver is damaged, fracture of the lower limb. As we know that right surface is from the 7th to 11th, and the anterior surface from the 6th to 10th. So, fracture of the lower limbs or penetrating wound which penetrate the intercostal space of the thorax or upper abdomen are common cause of liver injury. Blunt traumatic injury, no fracture, no penetration, only the blunt traumatic injury from automobile accident, which are also common, and severe hemorrhage accompanies tears of the organ. Rupture of the liver may take place in the blunt traumatic injury. The liver trauma, because of the anatomic research, has shown that the bile ducts, hepatic artery, and the portal veins are distributed in segmental manner. Appropriate ligation of this structure allows the surgeon to remove large portion of liver in patient with severe traumatic laceration of liver or with the liver tumor. Even large localized carcinomatous metastatic tumor have been successfully removed. This is the special organ which have the eight segment, and each segment have their own blood supply. So we can do the surgery, or the surgeon can do the surgery and save the remaining part of the segments. Now the another is the common itis means the inflammation. So inflammation of liver is called the hepatitis, caused by the viruses, alcohol, and the autoimmune condition. There are different types of the hepatitis. Hepatitis A, now how it's spread? To the contaminated food, water, or close contact. Second is viral hepatitis B, which is most dangerous and which is maybe acute and chronic, spread through the contact with the blood, contact with the blood, and other infected body fluids like semen or vaginal fluids from an infected person, potentially leading to cirrhosis and the liver cancer. If the blood is taken for the sample from the hepatitis B infected person and the same needle is used for another person, then the spread of these viruses to the another person because the previous person is infected. So through this contact, the hepatitis B develops. Hepatitis C is spread primarily through the blood contact, often from sharing needles, and the infection can be short-term or a serious lifelong condition leading to liver damage, cirrhosis, and liver cancer. Hepatitis D is severe liver inflammation caused by hepatitis B virus and can only be occurred in the people who already have the hepatitis B. And hepatitis E in liver disease caused by hepatitis C virus primarily spread to the contaminated water or the food. Now, congestion. In congestive cardiac failure, the pressure in the hepatic vein is raised, which leads to venous congestion in the liver cirrhosis. In biliary cirrhosis, there is a prolonged obstruction in the biliary duct. Now, the most common, that is fatty liver disease. Fatty liver disease is of two types, non-alcoholic and alcoholic. Non-alcoholic fatty liver disease is caused by fat built up in the liver, often linked with obesity, insulin-resistant type 2 diabetes, hypertension, high cholesterol, and metabolic syndrome. See, this is the color of the fatty liver. Normal color of the liver is reddish brown. This is the conversion of the yellow because of the fat deposition. Here the liver lost its friable consistency because of the fat deposition. This is the non-alcoholic fatty liver disease, which is also seen in the alcoholic liver disease by excessive consumption of the alcohol. But alcoholic liver disease have the many more steps if the person is continuously taking the alcohol. So first is this is the normal liver. See the color. This is reddish brown. This is fatty liver, which is 75 to 80%. And this is early stage of alcohol-related liver disease caused by excessive consumption, which leads to fat, okay, which leads to fat deposition in the liver. Then next stage after the fatty liver, if the person is continuously taking the alcohol, then the fibrosis develop, which is a type of life scarring that results from chronic excessive alcohol consumption, which causes inflammation and cell damage. See, this is the normal liver, then this is the fatty liver, and the person is also taking the alcohol constantly, then the fibrosis develop. Then the last stage, alcohol-related cirrhosis, advanced irreversible scarring of the liver resulting from the chronic heavy alcohol consumption. So normal liver, after taking the alcohol, the fat deposition in the liver, till continuing to taking alcohol, the fibrosis develop, and to taking alcohol, only the heavy alcohol drinker, ultimately the cirrhosis of the liver develop. So this is the stages of the alcoholic liver disease. This is the cirrhosis of the liver, chronic liver damage leading to fibrosis and impaired function and portal-like consistency. Not only the alcohol is the cause of the cirrhosis of the liver, but the cirrhosis of the liver may develop into another condition like autoimmune disease and the late stage of hepatitis. And autoimmune diseases like the rheumatoid arthritis and other autoimmune diseases. So cirrhosis of the liver, see the consistency, color of the liver. This is the normal liver, and this is the cirrhosis of the liver. Then the liver is the sunken. and impact function, and also it develop the portal hypertension because the pressure of the portal vein. Carcinoma of the liver, primary liver cancer like hepatocellular carcinoma or metastatic cancer. This is the features which we see in the liver cancer. Hepatic carcinoma is a primary malignancy of the liver parenchyma, and secondary occurs due to spread from the primary cancer elsewhere. And the last one, that is the ascites. Ascites is the abnormal buildup of excess fluid in the abdomen. See, you know about the peritoneum and the parietal and visceral peritoneum. And between the two layers of the peritoneum, there is a peritoneal cavity, and in which it is accumulated. That is called the ascites. Abnormal buildup. This is not a normal thing. Abnormal buildup of the excess fluid in the abdomen, causing swelling, discomfort, and potentiality and shortness of the breath because the pressure which raises upward and which gives the shortness of the breath. The most common cause is the liver, and that is the cirrhosis of the liver, but it can be also result from the heart failure, kidney disease, tuberculosis, and pancreatitis, where the interstitial fluid remain in the cavity, that is in the peritoneal cavity. Now about the medicine for the liver. Noxomica, Chaliconium, Lycopodium, Cardus, Phosphorus, Bryonia, Lepandra, Myrica, Netrumsum. Now, first about the Noxomica. What are the symptoms which are related with the liver we found in the Noxomica? That is the enlargement of the swollen liver, cannot bear anything tight around the waist. This is the typical symptom in the Noxomica. Hepatic colic is there, and spasm of the abdominal muscles there. Throbbing as from the hepatic abscess, stitches in the hepatic region, and worse from the contact or motion. Patient it move from one side to another. The throbbing pain is developed like stitches in the right region. Also hemorrhoidal colic with hard hearing, pressing pain in the small of the back and lower bowels with the vertigo and the headache. Chelidonium have the crampy pain, cramps in the inner angle of the right shoulder blade. So this pain refer to the right shoulder blade shooting pain from liver into the back. Patient complaining about the pain from the anterior part, anterior side to the posterior side. Bitter taste in the mouth with the nausea, constipation on exhausting diarrhea, and pressure on the eyeball are the symptoms. Then about the lycopodium, atrophic nutmeg liver is the typical symptom which we found after the investigation. Chronic form of hepatitis and the abscesses are there, chances of hepatic region sensitive to touch, sore aching as if from the shock. Patient is, if we palpate the liver or touch the right hypochondriac region, the patient is not comfortable. Tension in the region of the liver. Ascites from the liver affection, especially after abuse of alcohol. So alcoholic person where the cirrhosis is there, the ascites is developing, where we can give the lycopodium. Edema of the feet and the cold feet because of the ascites, the pressure over the feet. Tension in the hypochondria. Tension is all from the cord, making the diaphragmatic attachment cannot stretch and stand upright, and the violent gallstone colic. Then cardus marianus is the portal hyperemia, tetra of the biliary ducts, hepatic region sensitive to pressure. In previous, lycopodium sensitive to touch, here cardus is sensitive to pressure. Stitching, drowning pain in the liver, worse by pressure, worse by lying on the left side. And tardy peristaltic movement in the large intestine, embeds are there, tendency to excessive acidity and flatulence. Phosphorus, acute yellow atrophy of liver. Typical symptom of the phosphorus. diffuse hepatitis, malignant jaundice from venous obstruction, and frequently caused by alcoholism. So here the carcinoma of the liver, malignant jaundice. Jaundice then ultimately reaches to the carcinoma phase. So frequently caused by the alcoholism. Patient is sleeping during the commencement of the enlargement of the liver, followed by atrophy. Loss of appetite is also there with the unquenchable thirst. Gallbladder full of pale yellow streamy fluid and genuine alcoholic cirrhosis is found in the phosphorus. Then bryonia, pain in the right shoulder and yellowish face, white tongue, great thirst, constipation. Bryonia, the pain in the right shoulder. Also, we found the pain in the right side. Also, we found in the chelidonia, right shoulder bled, but shooting pain from the liver into the back. Here also in the bryonia, the pain also present in the right shoulder, but the yellowish face, the white tongue, the great thirst, and the constipation. These are the typical symptoms of the bryonia. And burning and stitching pain, worse from motion, pressure, cough, and deep inspiration, fullness of the stomach and abdomen. Leptandra, the hot aching pain in the liver, with chilliness along the spine. Pain in the liver is hot, but chilliness develop in the spine. Sharp cutting pain near the gallbladder, in the lower part, near the inferior border, and the posterior surface or inferior surface of the liver, where the sharp cutting pain is developed. Great burning distress in the back part of the liver and in the spine. Yellow tongue, constant nausea with vomiting of the bile and the loss of appetite. These are the symptoms of the jaundice and the hepatitis. Stools are dark, almost black. Usually in the jaundice, the stool is white, but here the stool is dark and almost black. Responding drowsy with hepatic derangement, and dizziness is there. Urine is dark colored, much soreness of the head and the eyebrow. Myrica, dull pain in the right side immediately below the ribs. Tongue thick coated with the yellow white coating. There are different features found in the different medicine in the of the homeopathy in the liver disorder. And here is also the no appetite, desire for the acid, and the unrefreshing sleep. Natrum sulf, stitches in the liver while walking in fresh air, and less sensitiveness of liver while working on the pressure. So if we see all the medicine, the different features are found in the Nux vomica, enlargement of the liver with the hepatic colic, with the hepatic throbbing pain related with the hepatic abscess. In the chelidonia, crampy pain referred to the right shoulder, but from the anterior to posterior aspect of the liver, with the test in mouth, constipation, excessive diarrhea. Lycopodium typical features, nutmeg liver, hepatic region sensitive to touch, ascites from the alcoholic drinkers, tension in the liver region and edema of the feet, cardus, portal hyperemia, sensitive to pressure, and here the loss of appetite in the phosphorus, but typical symptom acute atrophy. And here also the pain in the right shoulder in the bryonia, white tongue is here, yellowish space is there. Here the stool dark, yellow tongue, and in the myrica, the desire for the acid, tongue is thickly coated with the yellowish white coating. Usually, the symptoms of the jaundice are yellowish tongue, yellowish conjunctiva, yellowish urine, but in the different medicine we found the different features. Now, the liver function disorder, the rare medicine with chronic itching eczema, fumaria is there. For regulation of biliary function, Celsius is there. Specific for the liver cancer as adjuvant therapy, carcinoma hepatis is there. And for the bitter test, Terexecum, for the boring pain from the upper right abdomen to the shoulder blade, urine dark yellow, chelidonium is there. Functional complaint with dyspepsia, ossia is there. With fever, feeling generally worn out. Better after bilious vomiting, impetitorium is there. Sudden episodic pain radiating beneath the lower lips on the left side, that is berberis. See, the liver is on the right side, but in liver disorder, the radiating pain beneath the lower lips and the left side, berberis is indicated. Acid burning irritation made worse by bending forward, ecopyrum, prevent further development of gallstone, polystyrene, dragging pain in the back, poor appetite, Gardus, functional complaint after staphylococcal infection, where we are using the staphylococcus, strenuous, painful digestive activity, the nux vomica is there, appetite poor, repelled by bread or meat. This is the typical symptom. Natrum sulf, better after satisfactory emptying of the bowel. Sensitive to touch, tearing pain, light colored stool, there is teleria, bitter taste, tendency to oliguria, there is solidago, tendency to oliguria, solidaro. Specific symptom, solidaro is indicated, chronic elevated by hot drinks, right foot cold, left foot warm. Typical symptom, right foot cold, left foot warm, and chronic elevated by hot drinks, after cold diet, after anger, then specific medicines to chelidonium. Dyspepsia, flatulence, bloated abdomen, poor digestion, lycopodium, pain at the back of head, juglans, spastic enteralgia, plumbum mat, disturbances of biliary secretion, need to gently massage the liver, podophyllum, disturbances of biliary secretion, subicteric, that is dolichos, sensation of fullness, flatulence, constipation with futile, mandagora. So, thank you very much.
Thank you so much, sir, for this enlightening presentation. I'm sure our audience has gained a lot from it. Sir, given your years of experience, how do you feel about platforms like Homeopathy 360, which help in quality education for young homeopathic students?
For many years, I have started my practice and my academics. There are no such type of the tools are there to transferring the knowledge from one state to another or the entire world. So this is the best platform through which we can provide or we can share our knowledge to the juniors and the students. So this is a very good effort, and I'm thankful to the Homeopathy 360 to giving me opportunity to give my small knowledge about the anatomy, applied anatomy, and the therapeutics to the students and the juniors also.
It was an absolute pleasure, sir. And thank you, audience, for being so patient. This brings us to the end of today's session. Please stay connected with Homeopathy 360 for more such academic initiatives and webinar. Until next time, please take care and keep learning. Thank you, sir.
Thank you very much.